Okay, Dee, the floor is yours.
Okay. Some of you are kind of new, so just real briefly about my background. I worked 26 years for the child welfare system in this state, 17 in Spokane. Um, so I was a CPS caseworker, supervisor, area administrator, regional administrator, director of training, everything up the chain of command there except for the top job. And I spent 5 years at the University of Washington School of Social Work. I ran a training and research institute there. And then in 2010 went to Casey Family Programs, worked for them for 6 years in knowledge, a section called knowledge management. And then I did training for the next 8 years in with child welfare caseworker through contract with child welfare caseworkers in Washington. So anyway, that's the sort of the background here. And I do for those of you who are interested, I do monthly commentaries called Sounding Board. I send those out usually between about the 15th and the 20th, 21st of each month. And anyone who's interested, I've done that for a long time. Anyone who's interested in that, you can send me a request to put you on the distribution list. Be glad to do it. Or you can just look up, I'll give you a website. And if you want to look up that, you can. So so today we're going to talk about foster care and particularly foster care outcomes. So this is a big subject and we've got less than an hour here. So, we'll get through as much of this as I can. And maybe if we want to take another hour next month to continue the discussion here, we can. So I invite you at any point to break in, ask questions. You can put it in chat box or you can just speak up and I'll try to address whatever your question is. So before I start here, I think before I start talking about the research a little bit, I want to recommend a book on the history of foster care in the United States, which I think is, it's very helpful to have a historical perspective on this subject, particularly foster care. Foster care has got a long history and a long history before there was ever a child protective service system or a child welfare system of the sort we have today. Obviously, there was some form of child welfare in the past, but not anything like what we currently have. But there was from, oh, anywhere from the 1910s, 20s and on, there was, or even before that, there was a foster care system of sorts. And so anyway, this book I want to recommend is called Raising Government Children, Foster Care and the American Welfare System. So to say this again, Raising Government Children, Foster Care and the American Welfare System. And the author is a woman named Catherine Rymph, Rymph. And she's a professor of sociology at the University of Missouri. At least she was a few years ago when she published this book. And so this book is a very lucid, very, I would say, relatively concise kind of description of the history of foster care here. And one of the things, so a few of the themes, just real briefly about this book that come across here that puts current issues relating to foster care in some kind of a historical context and perspective is that foster care is always referred to a variety of different kind of arrangements. It's not, particularly in the early parts of the 20th century, it wasn't one thing exactly. It wasn't just, for example, children living in family homes with some kind of boarding rate. I mean, that some of that type of foster care existed, but there were also lots of institutions, lots of orphanages. There were even arrangements of what we would call now kind of apprenticeship, where sometimes children lived in foster homes and they paid for the cost of their board through working in some capacity. And probably the history of foster care in this country very, very influenced by child labor, because the orphan trains, of course, the early history of orphan trains in this country from the 1860s on had very much to do with sending children, mostly immigrant, mostly white immigrant children from large cities in the East, a lot of times farming families who lived in other parts of the country. And a lot of the reason those families did that was to, have the advantage of some kind of labor that the children could provide. So And that was at that time, that wasn't viewed as scandalous or anything. That was viewed as kind of par for the course in the sense that child labor was an accepted part of the way the society worked, and until probably the 1920s or so. And at that point, there was a very much of a change in social values in the United States and elsewhere as well. And that kind of foster care began to fade from the scene.
Shut up.
So, so just a few other things about Rem's book that I want to mention here is that part of it is that if you looked at any kind of scholarly discussion, public policy discussion from anywhere from the 1930s on, there's always been people who have been proclaiming a foster care crisis. I mean, the foster care systems in this country have existed in the sort of the state of duress, to say the least, or in the in a condition of very much acute shortages. That's been a common problem. The board rates that people were paid in the 20th century, you know, and really throughout the century were very inadequate for the most part. And so a lot of times really didn't even pay the cost of care. So there's very much been a theme of foster parents being exploited by governments over a long period of time. And there has been a huge resistance to calls that I have made, other people have made, to professionalize a part of the foster care parents, and a theme that I've written on a lot of times in recent years with really a lot of pushback from various sources. So there's just a lot of people that just flat offends their values. I mean, they just don't think that people should be paid, as in salary paid, for the cost of caring for kids. And so those kind of, you know, that kind of advocacy that I've engaged in, other people as well, has really not gotten very far in this country, partly for that reason, partly because, of course, legislators don't really want to invest in those kind of costs. I mean, that's part of it. And the other part of it just has to do with that just flat offends their values. So a couple other things to say about this before I start talking about foster care research in the United States. Of course, obviously, other developed countries in this world have foster care systems. Of course, obviously, all of Europe does, and those systems really vary tremendously. So, you know, so when you talk about, you know, foster care in the abstract, it really doesn't really have a lot of meaning. I mean, it would be like talking about medicine in the abstract. I mean, it might be one thing in an African country, another thing in certain parts of Asia, something else in the Europe, United States. I mean, just different kind of social contexts, different kind of policies, and different kind of uses as well. But one thing to keep in perspective here is that even in Western Europe, for the most part, most of those countries, and particularly countries in the northern part of Western Europe, they really have higher rates of foster care than is true in the United States today, especially because there have been such dramatic reductions in the number of kids in care here in recent years. But they had a lot more kids in care before these declines, right? And yet a lot of those kids were not in care due to child maltreatment. So that's one of the things to understand about both foster care in the United States in the 20th century and foster care in Europe even today. Lots of kids who went into foster care, they didn't go in because of child maltreatment, because of any kind of, and a lot of times they didn't go into foster care because of any kind of legal action. That's also something that is very much of recent origin, the idea that foster care arrangements should be sort of set in the context that should have some kind of legal structure, that kids would be dependent, that there would be permanent planning laws attached to those kind of placements, timelines for kids being in placement. And so all of that is recent within the last few decades or so. That's not how foster care for the most part has operated either in the United States or in Europe. And so, for example, in lots of places in Northern Europe, you have much higher rates of foster care in the United States, but for the most part, yeah. So anyway, for the most part, those kids are not in care through legal structure. Most of them are not in care because of child maltreatment findings. They're usually in care because of behavior problems. And a lot of times there isn't any kind of particularly permanent planning structure that applies to those kids in care. That is, the governments that are paying for their care are not insisting that the kids either be reunited or, have some other kind of permanency within some kind of X time frame. That kind of legal structure very much pertains to the United States and to other English-speaking countries such as Canada, England, Australia, so forth. So this is kind of the first idea that I want to get across here, is that when you start talking about foster care research in the abstract, it really is kind of a misnomer to start off with, right? Because foster care systems, highly variable, and that's even true among states in the United States. Much less when you start talking about foster care systems in the US compared to foster care systems in Germany or Denmark or Finland or places like that. Maybe before I go any further here, I'll stop and see if anyone has comment or question. Okay, so the first thing I want to say about foster care research in the United States, and this would be true in other countries as well, is there really is a lot of it. Because foster care, as I've already mentioned, has been around a long time, for decades. Over 100 years in the United States, and if you count the orphan trains, a lot longer than that. And there has been a lot of research. And so many, many dozens of studies. So when anyone says that they have, and I occasionally hear this in talking with people or in having a back and forth on email with people, sometimes someone will communicate to me that they've read either they've read a study of foster care, or they've talked with someone about it, or they've read a summary of a research study that is being presented as being the last word about foster care. And I guess I have to start off with saying there is not ever going to be a last word about foster care. It is one of those ongoing kind of subjects that continues to have a lot of research done about it. And any one study is just one out of many dozens of studies. So in the very nature of things, when you're looking at what are the messages from those studies, or the most reliable, consistent set of messages from those studies, you necessarily are talking about the weight of the evidence, not about the conclusions of any one single study. So when I say this again, you're talking about the weight of the evidence. So that means that anyone who's summarizing that evidence, such as me now, or anyone else who would be doing that in a peer-reviewed journal or in some conference or something like that, they would be necessarily interpreting, they would be cherry picking to a certain extent. They would be picking the research studies that they think are the most reliable and the most convincing. And they might do that using different criteria. So for example, the studies that I pay the most attention to in the United States in recent years are ones that have come out of the National Studies of Child and Adolescent Well-Being. So this goes by the acronym of NSCAW, NSCAW, National Study of Child and Adolescent Well-Being. So there are now 3 different, so to speak, versions of this study, separated by years. And so there have been dozens. When I worked for Casey Family Program from about 2010 to 2016, at one point, I went back and looked at all the studies that had been published out of NSCAN data, NSCAW data, not NSCAN, NSCAW data. And at that point, it was between 60 and 70, something like that. That was a decade ago. So the NSCAW is just a sample of several thousand, 6,000 children with open child welfare cases around the country. Some of those kids in foster care, some in their own home, and really asking a whole variety of different kind of questions about the kids. And so the reason I like the NSCAW studies is because it is on purpose, it is designed as a national study. It is designed as a nationally representative study of child welfare systems by design. Whereas on the other hand, a lot of the other foster care studies and some very good ones, by the way, that I've read over the years, they're studies that use administrative data from one state. And so, for example, because you have had in the past so many well-known, esteemed, quasi-famous scholars from Berkeley and from San Diego State, and because California has such a huge administrative database, there have been a lot of foster care studies in this state based on administrative data from California. There was a very famous study done by an MIT economist named Joseph Doyle that was published about 2007 that was based solely and totally on kids between the ages of 4 and 16 in Illinois. So, and a lot of other studies. There have been studies of foster care done in Washington that are just studies of samples of Washington State kids. So to take a study, for example, done in Illinois or done in California, and then to say, well, this study found X, Y, and Z, and this is true of foster care in general, that is a very wrong kind of a conclusion to make there. That is what you might say overgeneralizing based on the findings of foster care in one state, and then saying, well, just assuming a lot of times, not even really even arguing, assuming that those same conclusions must be true of foster care in all these other states in the country, as well, a lot of times even around the world. And so when you read foster care studies, you have to read with some care and with some thought, and it helps to have some kind of perspective on the kind of research that has been done there. And to say this again, there has been a lot of research that has been done. And in recent years, of course, in the United States, because of the way our child welfare system operates, a lot of that research has been done on kids who've entered foster care due to child maltreatment and who have legal structure around them. And that is, they've been found legally dependent in the juvenile court, and they have permanent planning laws that apply to them around how long they can stay in care without a termination of parental rights being filed and so forth. All the legal structure that we're familiar with today, right? Now, I want to say that when I began working in child welfare in Colorado, actually in the early 1970s, I worked in child welfare in or around it for 50 and more years. And the first years that I worked in Washington State from about the 1978 to 2004, I would say the first 20 years that I was in Washington State, the foster care systems looked very different in this state than they look today. There were a lot of kids in care due to disabilities, and not because they had been abused or neglected by their parents, because their parents were pushing for those children to be in foster care. There were lots of kids who were in foster care, and to a certain extent, it's still in foster care today because of behavior problems. And a lot of times because their parents are advocating for their entry into foster care. So there have always been a large group of kids in the United States who've entered foster care, and this is even true in recent years, but it's much more so if you go back 20 and 30 years. A lot of kids who entered foster care because their parents simply couldn't cope with the challenges of caring for them, either because of the disabilities they had or because of their behavior problem. And so what's happened over the years is that the number and percentage of those kind of placements that are not due, at least on the surface of it, to child maltreatment, that gradually has gone down, that gradually has gone diminished, because through all these budget cutting exercises that have happened over the years, and like we're now in the middle of another one in this state, little by little, all the stuff that's not related to child maltreatment in child welfare systems had been kind of pushed out of those systems, not all at once, but little by little. So when push comes to shove and managers and policymakers have had to make very difficult decisions about how to spend limited resources, they have tended to focus on the activities that are related to child maltreatment, to intervention, prevention, treatment, and so forth, as opposed to other kind of purposes. And yet still, some kids remain in this state in care due to disabilities or due to behavior problems only. And some of the kids, even who entered due to child maltreatment, are really still in care mainly because of behavior problems. They're not really in care any longer because of a concern about their safety or as far as going back to parents or whatever. So before I go on, let me stop there and see if you have comments or questions here. Okay. So a few other just basics about foster care that I want to mention here, just to, I'm assuming that all of you are CASAs. I think that everyone on this call, pretty much, maybe there was one or two people who were from a juvenile court system or something. So one of the things to say here is that lots of kids come into foster care and leave pretty quickly. And they don't necessarily come to the attention of a court system. There's no legal action filed on them. So, for example, when I was in maybe around from 1995 to 2004, when I was a child welfare manager in this state, and I used to, help to put together these kind of stats on a regular basis. We had maybe 1 in 5, 1 in 4 kids who came into foster care that left foster care within 5 days. I mean, a lot of kids who came into care left within a few days, a very large number left within a month or two, right? And so the kids who remained in foster care for long periods of time, and that's for the most part, the kids with legal structure, the kind of kids that you're dealing with, they weren't necessarily always a representative sample of all the kids who were entering foster care. They were the kids who entered foster care because of very serious maltreatment that had been found in both at shelter care and later on in dependency action, right? So a little bit of a different group of kids there. So one of the things over the years, well, I want to go back to the NSCOS study here for just a second. So one of the best studies or one of the ones that I focus on because I think it's more revealing than a lot of the other studies that I've read over the years, is that, so this is from an NSCOS sample. That is these 5,000 or 6,000 kids, nationally representative sample around the country and so forth. So what this particular study found was that several things that were important. The first thing was that for kids who entered care of all ages, and then you kind of went 18 months out for the kids who were left in care at 18 months. What this one NSCOS study did that I'm going to talk about here for a few minutes was that it looked at the kids who had been at least stabilized for at least a 9-month period of time. That is, unlike most studies of placement and stability, it didn't just count the number of foster homes or receiving homes or residential care facilities that kids have been placed in. It asked a different kind of question. It asked, no matter how many placements there may have been in the first week or two or month or something like that, over an 18-month period, what percentage of those kids actually ended up in a stable placement for at least 9 months? So you understand what it's asking here. And so what it found that for the kids who were 10 years old and older, there were almost 30% of those kids, I think the actual number was maybe 28%, it's right in that area, who had not been stabilized for a 9-month period of time in that 18-month window. And so here's one of the first things to understand about foster care, at least from the studies in the United States in recent years. It's very, very different outcomes depending on the age of children at entry into care. different outcomes depending on the age of kids that entering into care. So the
Obviously.
short version of this is that the older a child is when they enter foster care, and the more behavior problems they have, challenges that they have when they enter care, the less likely it is that they're going to be stabilized in care. So when I say this again, the older the kid when they enter care, the child when they enter care, and the more behavior problems a child has when they enter care, whether that's due to child maltreatment or whatever it's due to, the less likely they're going to be stabilized in care. So this was almost 1 in 3 of the kids had not been stabilized for this 10 to 17-year-old age group, had not been stabilized for 9 months in an 18-month period of time, right? So that's really a pretty high rate of placement instability. And remember, that's a little bit different kind of measure. I mean, some of those kids may have been in 3 or 4 placements in the first month. I mean, the ones that were in the stable group, they may have been in a few placements in the first month, but they eventually found a stable home. But there were almost 1 in 3 of those kids in this 10 to 17-year-old age group who didn't find a stable home. Much lower rates of placement instability of that type for kids who were less than 10 when they entered care, and much, much lower for kids who did not have behavior problems. So when you take then kids who were 10 and older and they had behavior problems entering care, then there was a much greater likelihood that they were going to be moved from home to home and that they would not ultimately find a stable home. So this has been one of the sort of the persistent kind of issues, problems, challenges in foster care, both in the United States and in other places, because of the foster care model that we have. Remember, we have a volunteer foster care model. That is, we're not paying foster parents salaries for being foster parents. You know, we're recruiting people to presumably care for kids for the cost of what it is to care for them. And so we're not looking for people who've had a background in dealing with behaviorally troubled kids, or who have a special commitment to doing that because they just have an interest in it or they have some background in it. That's not the way U.S. foster care systems operate by and large. They're recruiting people who really want to help kids and who don't necessarily have, a lot of background, experience, or education in how to do that when you talk about the troubled kid population. So it should not be a super surprise then that a lot of those folks have trouble in managing the behavior problems of kids who come into the foster care system. And that is and the percentage of kids who have those behavior problems is going to be larger the older the kid is at the time that they enter the foster care system. So, perhaps some of the more experienced of you on this call will remember that this state actually had a class action lawsuit based on this multiple placement issue called Brahms, which went on for several years, maybe almost as much as a decade. And there was a settlement agreement after a very unpleasant, to say the least, court action over the whole thing. The parties finally entered into a settlement agreement over how to reduce placement instability and so on. And that agreement went on for maybe 8 or 9 years at least, something like that. And it was overseen by a judge in Bellingham. And then sometime, maybe a decade ago, something like that, it was dismissed. And just my take on it is just, I think all the parties to that lawsuit just got tired of it. I don't think it achieved much. But the point being that very, very difficult to make much of a dent in placement instability, particularly for behaviorally troubled kids, which, by the way, that's not obviously the only reason that kids are moved from home to home, but it's a very common reason, probably the most common reason. Very hard to make a dent in that as long as a state is going to stick with this volunteer foster care model, because people aren't trained to do that. They don't have the educational background to do it. Now, I have met over the years in this state a group of foster parents who usually through trial and error and through their own perseverance and persistence, and their just plain old intense desire to help kids have learned how to do it. There has actually always been a group of people in this state who identify as professional foster parents. That is, they're not designated by the child welfare system as professionals, but they self-identify in that way. And they view foster care as kind of a vocation. And little by little, many of those folks have learned what are the kind of arrangements that are going to allow them to stabilize behaviorally troubled kids in care. There have always been a group of people like that, but not enough. So what I have tried to propose over the years and over and over and over again is that for somewhere like 1 in 10 to 1 in 20 kids, somewhere in the 5 to 10% range of kids in foster care, we need to have a professional cadre of foster parents who are trained and supported to deal with behaviorally troubled kids if we want to stabilize children in foster care. And it's very, very difficult to help kids in a therapeutic way in foster care if you cannot stabilize them. And so back to one of the main findings in the NSCAW study, this is back to the David Rubin study, the one I mentioned, almost 1 in 3 kids, 10 to 17, who came into care, not stabilized for 9 months within an 18-month period of time. What that Rubin study found is that every move that those kids made their behavior problems worse. If the kids entered care with behavior problems, and then due to those behavior problems, they were moved from home to home, and often quite suddenly, often without much planning at all, sometimes with just a call to the caseworker, as in, come get this kid tomorrow. And so every one of those placements hurt those behavioral troubled kids in terms of psychosocial outcomes. On the other hand, what the Rubin study found was that for almost half of the kids who entered care who didn't have behavior problems, and by the way, the idea that every kid who enters foster care has behavior problems due to child maltreatment, this is just not true. I mean, there's a large group of kids who enter care with either no behavior problems at all compared to other sort of normal samples, or very, very minor ones. For those kids, Rubin found those kids, the ones who stayed in care more than 18 months, compared to the kids who were reunified within that 18-month kind of time frame, a lot of the times the kids in foster care did better on standard psychosocial measures, particularly on academic measures, how they were doing in school, than kids who went home. So you end up here with this very sort of, and this is why I focused on this idea of a split kind of foster care system. And I've called that a way of dissecting foster care. There's a group of kids that foster care really, really benefits a lot of the times, particularly if they come from maltreating families. And those are the kids who are a lot of times who enter care without a lot of behavior problems. They're emotionally satisfying to care for because they are affectionate. They accept nurturance. They respond to love and affection. They are stabilized in homes. And a lot of times those kids do a lot better in foster care than they were doing in birth families, or even compared to the kids who are in foster care and then who go back to birth families. Compared to the kids who enter care with behavior problems, and those behavior problems then a lot of times become worse when they're in foster care, because at the very basic level, they are not being stabilized, in addition to whatever else is happening to them in care. So you have these kind of two groups of kids. And this is why the idea that someone is going to look at a bunch of foster care studies, and then they're going to kind of reduce this whole subject to a thumbs up or thumbs down kind of a way of reflecting on foster care. I just don't have any respect for that. So you really have to look at specific groups of kids. And by the way, most of the research that has been done in the last 20, 30 years in this country, for the most part, the outcomes that researchers have focused on have been psychosocial outcomes. That is, they have been things related to school performance, or they have been, as in percentage of kids in special education, number of kids who have been promoted from one grade to another in a kind of a normal fashion. Sometimes where kids stand on test scores. There have been a number of foster care studies that have looked at delinquency rates in adolescents. That is, what percentage of kids in foster care, who enter foster care, for example, before the age of 12, during their teenage years end up involved with the juvenile justice system in some way, either in detention or in some other kind of fashion kind of thing there. And it would be fair to say, and I guess I want to come back and say this a couple of times, there's, again, an awful lot of studies here. If you had to characterize all of those studies together, the shortest, concise, one-word description of outcomes would be mixed. Some foster care studies have found benefits for foster kids. Some have found major disadvantages for foster kids in terms of psychosocial outcomes. And for reasons that I've already mentioned here. So this famous, for example, this Joseph Doyle study, and the one that a lot of people have, a study that a lot of critics of foster care has held up as being the most damning indictment of foster care, blah, blah, blah. It's not. It's done solely on kids in Illinois who are in the 4 to 16-year-old age range and first entries into care, right? So that study found, for so to speak, the kids who were marginal, that is, who some caseworkers might have placed those kids, other caseworkers not. By the time they were 15, 16, they had elevated rates of juvenile justice involvement. Okay. Almost exactly the same study done 12 to 15 years later in Michigan by a group that just published their results within the last 2 years. Totally opposite outcome. Same methodology. This is now Michigan. Much lower rates of juvenile justice involvement for those kids who were in the Michigan foster care system before the age of 10. After the age of 5, before the age of 10, carry on in a longitudinal way for several years and look at juvenile justice involvement. Much better outcomes for the foster care in Michigan, much worse outcomes for the kids in Illinois. Now, that doesn't mean that one of those studies is right and one is wrong. They could both be completely right, because the Illinois foster care system is not the Michigan foster care system. So, got to look at results with some kind of, discernment. Maybe that's the way to kind of put it there. So before I go any further, let me see, where are we? Let me go any further, talk about a little bit more about this. Let me stop and see if they have comments or questions here. Okay, so I just mentioned a couple of minutes ago that most of the US studies done in this country have been done, the outcome of interest was some kind of psychosocial outcome. That is educational performance or juvenile justice involvement, or the percentage of kids who had some kind of DSM-4, that is, they had been found to be anxious or depressed or have PTSD or something, some outcome of that type. But I think, obviously the kids that are being placed in US foster care systems due to child maltreatment, I mean, main outcome that most of us are interested in have to do with child safety. I mean, how are the kids doing who have child safety concerns? That's why they're in foster care. And how are those kids doing compared to kids who remained in their own home? Well, obviously, part of the reason that there are not that many, I'm going to talk about a few studies here, but the reason that there are not more than a few studies of this is because it's very hard to set up a fair-minded, balanced experiment of that type. How exactly would you do it? I mean, you're not going to use random assignment. You're not going to use some kind of, you're not going to leave some kind of kids perceived to be at risk of imminent harm in their parents' home because you want to see what happens to them. I mean, that would be unethical. And so if you're looking at the two groups, well, clearly there's going to have to be a difference in maltreatment histories. That would be the reason that one group would be in foster care and the other group wouldn't. So not at all easy at first glance to see how you would do these studies. And that's one of the reasons that there aren't a lot of them. But there are a few. And so I'm going to talk about just the few. And I want to emphasize the few thing because once you only have a handful of studies, even if the study is extremely well designed, even if it's extremely well done, if it has not been replicated a number of times, then you ought not to have a super amount of confidence in it. That is, even if the study you have, and some of these studies have been done by researchers for whom I have the highest regard, but it's only one study. I mean, and the source of confidence in science is replication. So it's when you replicate a study over and over again and you get the same kind of results again and again. That's the source of confidence there, right? So with the studies that have focused on child safety outcomes, you just don't have that replication history for reasons that I've already mentioned here. But I want to mention just a few of these studies, just to give you a sense of where they are. So one of the best ones, or one of the ones at least I like the best, was done in Washington State in the mid to late 1990s by it was then called ORDA, the Office of Research and Data Analysis with DSHS. So if perhaps you will remember that for many, many years in this state, DSHS was the umbrella agency for child welfare. DSHS then had its own research branch. And it did studies of foster care as well as other kind of studies related to child welfare and lots of other subjects as well. So a few researchers then in the mid to late 1990s in Washington State took a birth cohort of about something less than 300,000 kids. I think it may have been like 270, 260, 270. In other words, a very, very large sample of kids who had been born in Washington State within a certain time frame. And then it followed all of those kids. So you got a very large sample here. And then it followed the kids who then had subsequent, within the first 3 years of life, those kids who then had subsequent reports to CPS or were involved with child welfare in some other way within the first 3 years of life. And it began to compare, it then compared those kids who had child welfare involvement, mostly CPS involvement, with the kids who didn't have any CPS involvement. And it also looked very carefully at the children's disabilities. It had information on the rates of the extent to which the mothers or parents of those kids were receiving Title 19 substance abuse treatment services or mental health services. So in other words, it was a very careful, well-designed study. And the interesting thing about this particular study is that, which took, by the way, 4 years. It was a longitudinal study that took 4 years to complete, another year to write or something. It was never published in any journal. Why was it not published in any journal? Because DSHS didn't like the results at the very top of the agency. Well, why didn't they like the results? Because it found out that if you took out, and this was, by the way, this study was focused on all-cause mortality. So it wasn't just focused on child maltreatment death, it was focused on child deaths, but on deaths from all causes. That is disease, congenital anomalies, accidents, whatever it was, the whole range of deaths there. And it found out that after the first 28 days of care, taking out all the kids who died in the first month of their lives, if you put those kids aside, because a lot of kids who die due to birth anomalies and other kind of issues related, pregnancy delivery just does not turn out well. Take all those kids and put them aside. Kids in foster care had pretty much the same death rate as kids in the normal population. Kids referred to CPS, whether they had been placed or not, had about twice the death rates from all causes. So this was a study of all-cause mortality on a sample of about 270,000 kids. So this study is still available, by the way, and partly because of I kept bringing attention to it over the years, finally, Ross Hunter, just basically to shut me up, I think, he actually ended up posting that on the DCYF website. So that study is actually available. That actually study is available online, right? And you can look at that. And by the way, I was told by people in ORDA, which later changed its name to RDA, Research and Data Analysis. I was told that in the maybe 10 years later, that group of people went back and did the same study again, just to see whether and they got the same results again. But again, it was not a published study. Now, one of the things that they found there in that study was that most of the kids who, remember, this was a study of all-cause mortality. Most of the kids who died there, they didn't die of maltreatment. They didn't die because they were physically abused or there was no accusation of neglect. Most of them died of diseases. You know, there are many more kids died of diseases than died of maltreatment. So come back to about us from maybe 3 to 4 years ago, a group of researchers in California. Remember, California has this huge administrative database. They did a sort of a same kind of a study in California based on kids who had in the first year of who died in the first year of life. And they compared a whole birth cohort, that is all the kids born in California within a couple of years, a year or two, compared to the kids who had been in foster care in California subsequent to their birth. And they found that, again, that about the kids in foster care died from disease at about half the rate of kids in birth families. Once you control for a bunch of socioeconomic factors here, such as poverty, that would be one, but also status, health status at birth. So that's one of the few studies that have been, and by the way, there has not been a lot of attention given to that study, that particular study of health outcomes in California, really, in part because, of course, there's been such a negative view of foster care promulgated in this country in recent years that any study that might have say something positive about foster care is just ignored. I mean, that's kind of what happens when the social milieu has a certain kind of opinion. So there have been a couple of other studies, and they're about 15 to 20 years old, and they sort of along the same kind of lines there. That is, for very young kids in care, even despite placement instability and so forth, particularly when there had been long histories of chronic maltreatment, particularly for the younger kids in the foster care system tended to do better in terms of child safety outcomes, that is. And because why? Because they're measuring maltreatment. And some of the kids who were not in foster care were not just maltreated, they were chronically maltreated. And that was viewed as a child safety outcome. So this is not a huge range of studies here. So I want to say that again. This is a small number. Now, let me just go on the kind of thing. I'm going to run out of time here, but let me go on the other side of things here. So some of the most distressing findings are relative to the issue around safety of children in foster care have come out of Chapin Hall and other kind of studies of kids aging out of foster care in the United States. Studies of kids of young people between the ages of 18 to 21, sometimes older, 23, 24, 25, and so forth. And some of these researchers have gone back and asked these kids, like surveyed the kids in an anonymous way about their experiences in foster care. That is the extent to which, from the kids' perspective, they were abused or they were neglected or they were mistreated in some kind of way and so forth. And several of these studies, and this isn't just one study now, this is a replicable, this is a finding that has been found more than one time, both by Chapin Hall and by other studies as well. These young people who have aged out of care report very high rates of abuse and neglect in care, and much higher rates than are reported in the official statistics of public agencies. So, for example, in one of the Chapin Hall studies, more than a third of the kids aging out of care reported that they had been abused or neglected in care. And so this has been a surprise to me, that is, I was a child welfare manager for a lot of years. And of course, there were times when kids were abused in care and sexually abused in care, but I could not remember a time in Washington State when there was a finding that a child in care had been neglected because of just plain didn't have enough to eat in care. But some of these studies that Chapin Hall, the ones that Chapin Hall has done, the survey of kids aging out of care, have found that a surprising percentage of young people aging out of foster care in the United States report that they didn't have enough to eat in care, in either residential care facilities or in so. So that's one source. Second source is that when I was a child welfare manager, I became very reluctant to put any young adolescent child in a residential care facility because of my anticipation that that child would be bullied in care by peers who were older and stronger. Same dynamics as in adult prisons. The strong prey on the weak. And so part of the reason that residential care has gotten a bad reputation in this country because there has been so much of that kind of peer abuse, peer sexual, and there have been very famous cases, I don't know what cases, legal actions in this state. And this state has paid out millions and millions of dollars over the abuse of kids in residential care in this state in the past 30 to 40 years. So I was in Region 6 at the time that OK Boys Ranch, this Olympia facility, where kids were harassed. They were sexually abused by both other residents and by staff as a kind of a hazing, as a kind of an entry-level initiation thing. And those kind of activities went on at OK Boys Ranch over a period of 15 years. It took more than 15 years to close that facility. And then the state ended up paying in excess at least $40 million in lawsuits and perhaps more. So that's the second kind of issue. So lots of concerns around the safety, particularly of adolescents in care. And again, back to the issue around behaviorally troubled adolescents in care. And then the last issue that I want to make, we're going to run out of time here, give you a chance to ask a question or make comment, is the issue of the misuse of psychotropic drugs with behaviorally troubled in kids in care. And this isn't just adolescents. This is particularly kids in the school age range, anywhere from 6, 7, 8, 9, 10, being put on very high doses of psychotropic cocktails. And there are all kind of studies and surveys of that. So there's a lot of information on that. And these percentages of kids who have received that kind of treatment are shockingly large, because it appears what has happened is that states have made up their deficits in the availability of mental health services by allowing foster parents to take children to their doctors and having drugs prescribed to, basically chemical sedatives in order to manage and control their behavior. So issues related to peer abuse, issues related to psychotropic meds, issues just plain old related to mistreatment, particularly of the adolescents in care, the kids who have aged out of care. Now, one last statement about this. As shocking as bad as that is, it is not grounds for saying that that's what happens to all kids in foster care. Those studies particularly pertain to adolescents in care, adolescents who have behavioral troubles in care. So this is why I say it's one thing to talk about foster care for kids who are in the sort of 0 to 8, 0 to 9-year-old age range. Another thing to talk about foster care for kids who are in the 10 to 17, 18-year-old age range, and particularly the ones who end up in residential care facilities, right? Now, we've run out of time here, so I'm just going to say, and maybe we can follow up with some additional discussion the next time, right? Because of all these concerns about the quality of care and, in the residential care facilities in this state began to disinvest in those facilities, even when I was a manager, and I was very much a part of that. I was very much supportive of that for reasons that I've just mentioned here. But in disinvesting in residential care, the state did not, alas, make investments in other kind of better care. So you ended up with a period of more than 10 years here, really a shockingly long period of time, where adolescents in this state many times have been behaviorally troubled kids, and some kids who are not behaviorally troubled have been put in hotels. There's a whole period of years where the kids were sent out of state, thousands of miles away. There was 1 year, or maybe more than a year here within the last 4 or 5 years, where kids were sleeping in offices or sometimes even in cars. And of course, these things have gone on in other states as well. So this is not something that's, a unique problem to Washington State by any means. So they're all kind of very good reasons to try to downscale or reduce the number of kids in residential care. And this state has been right out there in front of that effort to do that, but without making investments in better, supportive, safe, therapeutic ways of taking care of those kids. And so you've kind of taken away one kind of abuse and substituted another. And now within the last year or two, it seems like finally the state has started to get a little bit of handle on that, because it's, if you can believe it, it's opened its own facilities. And particularly there's one in Region 6 and one in Region 4 where staff employed by DCYF are taking care of these kind of kids on an emergency kind of basis here, right? So maybe I'll stop with that and see if you have a comment or question.
Dee, this is John Williams. I've got my notes in front of me, and thank you for your presentation. The I have in my notes, we have a volunteer foster care model that the foster parents, if you will, self-identify as professional. Is there a standard uniform rate per child that is paid to foster parents to provide the home and care for children, or does it vary with age and so forth?
Yes, there is a complex kind of payment system. I'm not sure how much has changed in recent years. I mean, but I think it probably has changed. But of course, the rates increase with age of child, and they also tend to increase with behavior problems of kids and with their disabilities. And so for years, this state paid on the basis of 4 payment levels. You could be level 1, level 2, level 3, or level 4. And it used to be that the level 1 and 2 payments were in the 400 to 500 range, and maybe the level 3 and 4 payments were in the $1,100 to $1,200 range, something like that. Well, and they may be a lot more today, because this is based on what was going on a long time ago, right? But if you kind of look at what those payment rates are up against the rates in residential care, even at the top level, level 3 and 4, it probably wasn't more of a third of the rate being paid at the lowest rate of residential care. And so there have been some shockingly high rates paid in the residential care area, both for kids in this state and kids who have been sent to other states. And so, and I mean rates in the sort of anywhere from the $10,000 to $25,000 a month range. And that, of course, has been one of the reasons that the legislature has been extremely loath to make investments in residential care to try to improve it. Because I think one of the lessons in recent years is that as risky as residential care is, there's a percentage of kids in this state who really, because of the difficulty of care, really need to be in resident, and sometimes they need to be in locked residential care. Well, I've already mentioned the reasons that's kind of inherently dangerous, right? But so states, you really have to, if you're unsatisfied with the quality of a system, you have to invest money to try to improve that system. And one of the things that you do, for example, is that you pay better salaries. You set some kind of minimal expectations on experience and education. And you put yourself, because of salaries, in a position to actually recruit people who are more likely to be able to do a good job with those kids. I mean, so that obviously going to cost a lot of money here. So what I'm saying is that policymakers face some very tough choices here. And this is why this situation has not been resolved over a period of much more than a decade here. Even despite, remember the Brahms settlement, which eliminated all this stuff? As soon as Brahms went away, it all came back. And why? Because of the issues related partly to cost, but partly also to the difficulty of maintaining the safety of kids in residential care and the cost of affording some kind of alternatives. And so the alternative that I have proposed over the years is to recruit a few hundred professional foster parents in the state and to pay them salaries, to recruit them and support them and pay them as professionals. Not for all kids in care, but for 5 to 10% of the kids in care. But even with that idea of investing in professional foster parents, which I still think we should, right? We still are going to need some locked residential care facilities for a small fraction of kids. And it's probably not more than 1 to 2% of all the kids in foster care. So the thing that has been amazing in this state in recent years, we have let about 100 to 200 kids. Remember, this state has 7.5 million people or more. This state probably has 1.8 million kids. We have let 100 to 200 kids, behaviorally troubled kids in this state, practically bring the child welfare system to its knees in recent years because of an unwillingness to make improvements to create places that could handle those 1 to 200 kids. And truthfully, it could be even less. I could be actually exaggerating here. But it's not a large number is what I'm saying. So it's not an unmanageable problem. The idea that somehow it's cost prohibitive, we couldn't afford this, that's all baloney. It partly is because people have not been able to decide on what is the right solution here. There has been such a dislike of the residential care industry. And for reasons that I've already mentioned, some pretty valid reasons, there have been some pretty terrible things happen in Washington and other states in residential care. But you like the idea of kids staying overnight in hotels, being moved every 24 hours from one home to another? Everyone liked that idea? So that stuff has gone on in this state for more than 10 years, where you have some foster parents being paid $300 to $600 a night for giving a kid a bed and not even feeding them breakfast or dinner, and that's supposedly acceptable practice. Now, when you talk about stuff like that, that's not a condemnation of foster care in the abstract. That's a condemnation of a particular group of policymakers and managers who have done this over a period of several years. And they had their reasons. I'm not saying they didn't. But the blame for that is not foster care in the abstract. It's foster care as it has been implemented in a specific place and time, as in our state in the last 10 years. And particularly since DCYF has been in charge there. So yeah, and there are some, well, I guess what I'm trying to get across here, some very reasonable, doable solutions to this. And to their credit, finally, within the last year or two, DCYF has begun to do something positive about that. I mean, there's still a lot of that, hotel placement stuff that's going on. And they have been very, very closed about the quality of care in these facilities that their staff are running. So I might end up having to bite my tongue several times when some information comes out about that. But one of the things we need to do, and that, I wish the ombudsman in this office in this state would do, is make transparent what's going on in those DCYF run facilities. What's the quality of care there? And at this point, I would have to say, and I have an interest in this, I don't know. I mean, I've been told by people in the system that it's decent, it's good. This is why I'm saying that it's a positive move. Some people that I respect have told me that they think the quality of care is good. Well, I would like to know that in terms of a study. I'd like to have someone take a look at that. And in the meantime, I would also like to see some kind of commitment to gradually, little by little, building a cadre of professional foster parents for dealing with the behaviorally troubled kids that this state is inevitably going to have. So just one other kind of thing, and I'll let you go. 1.8 million kids. As of a couple of years ago, this state had less than 100 CLIP beds. And you can, maybe you know what CLIP is, but those are the kids who are overtly mentally ill. And so very expensive, very difficult kids to care for. 1.8 million kids, less than 100 placements. I mean, come on. No, that's not a serious commitment to child welfare there. That's sad and pathetic. So one of the solutions there is that this state needs to double. Some of it's obvious. Need to double the number of CLIP beds there. Now you end up in a situation here. Now the state is in one of these budget cutting things, and when I worked for the state, every 4 to 6 years there was a budget cutting exercise. I mean, this is what's going on now is not unusual. It's very much in line with the history of having to balance the state budget, right? But there will be a time when it will be different. So I think we're going to stop there. And anyone you can have questions. Ryan can give you my email address, and then next month, since this is a big subject, maybe we'll come back to this again and talk about some version of this again in a month.